Okay, good morning, Commissioner. It is Sunday, April 25th, 2021. We are about to say goodbye to yet another month on the calendar.
Yeah, this time last year we were in the throes of the pandemic and really having a scary time of it. If we think about where we were this time last year, we were about a month in, and just really everything was reeling. So here we go. Thank you to
Yeah.
our regulars. Thank you to those who have hung in there with us for the last 13 months because, you have heard information firsthand. And what we have found over the last couple of weeks, particularly, that the remote world is hard from a communication standpoint, and when people or leaders of the department try to interpret what we've been saying, or if someone watches the video or hears about it from somebody else, it becomes like a giant game of telephone. This the way to talk to each other this way every week or every 2 weeks has been the way to kind of keep us talking to each other and keeping us hearing things firsthand. So
Yes,
hello.
yes. So here we are a year later, and we wanted to really clarify some significant messages regarding in-person contact and increasing the re-entry capacity in our offices. Lots of information out there.
Yep.
Commissioner, what are the key components of this that you would like staff to know?
Right. Let's break it down into those two distinct things. The first is in person contacts. So,
Yep.
what everyone needs to know directly from us is that by May 20th, the governor's executive orders of an emergency declaration have been extended by the legislature to May 20th. That's the date that we're working from. And so, what we have told you all along is that any changes to your work schedule will be kind of given to you in enough time to make some, real life changes. So when we were given that May 20th date, we started talking with our leadership about, what does that mean for us? So if we think about the first piece of that in terms of in-person contacts, we
Yep.
know that we have been operating with virtual contacts unless the safety or risk or whatever it is that contact is presents a situation in which we have to be in person. So now we know that our work, and everybody, just kind of
Mm-hmm.
listening to the video, nobody can dispute that our work is best delivered face to face. No question.
Mm-hmm.
And
Absolutely.
but we know during the pandemic, there have been those of us who have been in person 100% of the time. Think about people like at our facilities. They have to do their
Yes.
work in person 100% of the time. We know that because of the dangers of this pandemic, and the permission to use telework differently, that we have had various percentages of our work being conducted in person. So what we have decided is that, just because something can be done remotely, what is the best practice of what should be done
Should
remotely?
be done. Yep.
And so now we're shifting from the majority of our work being done remotely to the majority of our work being done in person
In
again,
person.
with the virtual work being an option if a manager or if someone that directs a particular part of the agency deems that it needs to be remote still, because we know that there are some things that are going to stay in the remote space. But
Mm-hmm.
again, we operate with a authorizing environment, so we are gathering all the information from the telework survey, all the information from the COVID-19 mailbox. You all have given us some wonderful, like over about 1,600 people have done the telework survey right now.
Survey.
It's
Yep.
open for another couple of days. We want to hear what those things are that have worked really well in the remote environment, because we then inform the bigger body at Department of Administrative Services and Office of Labor Relations what
OLR.
we
Yep.
think um, DCF can do in a telework environment. I don't know that I would have known that a year ago. We've learned so much about what of our work is able to be done that way, and it's definitely going to be a part of our toolbox. So as we shift from the majority of our contacts being virtual to the majority of our contacts being in person, we wanted to do that in a gradual way.
Mm-hmm.
We also know that with increased in-person work, there's likely going to be increased foot traffic in our area offices and in our
Offices.
central office. So what we said was, we said to our leaders of the department, you all need to control who's going to be physically in a space at
Right.
any given time.
Right.
That resulted in some mixed messages
Saying,
of, you gotta come,
everybody.
right? Everybody has to come. Half of us have to come. Half of us have
Get
to
over
come.
here. Get over here.
Right.
Yeah.
God bless our leaders for really trying to put some structure around that, because it's going to be hard. We can't have any more than 50% of people in any space at any given time. So what you'll see is, our attempts at really trying to flush out what that will look like in terms of reentry into our spaces. So the first part of this is our in-person
Person
contacts
contact.
need to start shifting to more in person, and then the different types of contacts those are. And then the second piece is how many people can be in a space at any given time. Engineering has done a tremendous job of putting up signage,
Yeah.
putting up additional hand sanitizing stations, all kinds of things. And as you start to think about what that looks like, nobody's saying tomorrow you have to go back into a space, not even in the next couple of weeks, but we know that the time is coming. So as we spend more time in person with our families, we have to think about what it's going to look like if and when we are back in the offices. So I hope that clarifies some of the discrepancies that were out there, because people are just trying to figure it out. And we knew that the messaging was getting muddled because your unions told us this week. They were just like, "What are
Oh
you
yeah.
guys doing?" And
Yeah.
honestly, we've done nothing but try to be as transparent as open, and recognizing that people have made some huge sacrifices this last year, trying to take care of elderly relatives, trying to take care of kids who are distance learning, trying to keep themselves safe, and having to just upend our lives the way we have over the last year and still do our work has just been,
Yeah.
I can't even say enough about how impressed I've been with our workforce. So, everybody take a deep breath. We're just trying to make sure that you have enough time to make those changes to your scheduling or circumstances. But for right now, just think about what it would take to shift from the virtual contacts that you've been having with families to more in person, face to face contacts with
Hmm.
either our families, our vendors, potential places that we license and relicense, all of those things that go into the work that we do. And as the Connecticut opens up with more and more vaccine, we are second in the country for the percent of
Wow.
our
Second now.
population who have been vaccinated. We have to think about what our contacts look like with the public too, in terms of how we represent what DCF is and what we do. As far as the reentry into the offices, right now we're only at about 10%
I think
in
so.
each of our
Yeah.
spaces of people being there. So if we know that getting to 50% is quite a jump, it's going to be gradual, and we want people to start feeling comfortable with all the adaptations that have been made. We want to do it safely. We want to do it planfully, and first and foremost, we want to make sure that you are incorporated into our thinking and our planning, as are the kids and families that we serve. So hopefully that clarifies things for people. We will be embedding a memo with this in writing
Yep.
into this the newsletter this week, as well as we'll send a separate memo to on just this issue. But yeah, again, thank you to our
Yeah.
regulars who are hearing this firsthand, because you've been right along with us, and knowing that everything that we have said during these videos is stuff that we've been able to follow through with. So no
Absolutely.
shell games here. I'm talking to the
Absolutely.
DCF that I know.
Great. And Commissioner, if I could just take a moment too to give a shout out to the staff who actually have provided feedback in the COVID-19 mailbox. You are heard. Your thoughts, your impressions, the questions you have
Yeah.
inform the memorandums you send out, the discussions that we have here. And I think, since Friday, we've had 3 or 4 people that, we had responded to between that time about exactly the in-person contact and increasing the reentry capacity. So we're with you. Keep that feedback loop coming. We want to be as transparent as we can be, and we want to hear from all of you. So,
Yeah.
um,
Yep. That's been
so
great. That's how every week, every time we put together our agenda, most of the time it comes from topics from the COVID-19 mailbox. I'm
you
so glad
bet.
you all stood that up from the beginning. That's been a great way to keep talking to each other. Shit, man, Remember, when we used to be able to have staff meetings where you cram 100 people into a conference room and you talk face to face. Well, this is different.
Yeah.
Just we talk to each other, and then we hear from all of our staff across the state. So hang in there, you guys. We're I see the finish line, but
Yes.
it's still not within reach yet.
Yes. So, Commissioner, as another support to staff, this Thursday is the fourth discussion that DCF and DEMIS have organized um, for our community members to discuss particular aspects of the pandemic. Can you explain what Thursday is going to be?
Yeah, it's a fourth iteration of community conversations related to healing strategies from COVID, racial unrest, and economic devastation. And we know that that imperfect storm, is what we've been calling it, has created just havoc on all of our
Yeah.
communities. And these have been hugely successful community conversations that we've had virtually. The Office of the Governor, plus DEMIS and DCF, along with some community stakeholders, have been having these conversations over the last few months with different topics. And the last one a couple of months ago was kind of a fishbowl, listening to Black men talk about the impact of racism and the pandemic, and everything associated with that. And from there was a young man who was, I believe, 14 years old, who made a comment during the last session, and his words and the support of him from those in attendance were so powerful that we decided this iteration would be focused on Black and brown boys between the ages of 12 and 22. And we know, with the national conversation about race, the local and state discussions related to
Hmm.
race relations, gun violence, just understanding equity gaps, and all kinds of things that impact the role of Black and brown people in the context of the broader society, are really front and center in our dialogue. So these community conversations are a way for us to participate with our sister state agency in a way that's pretty unique. So
Yeah.
if those of you that either fit into that demographic of a Black or brown male between the ages of 12 or 22, or you have somebody on your caseload that fits in that, to register for it. But then all of us who don't fit into that category, to register to listen in. And you just learn and hear a different perspective when you participate in forums like that. So yeah,
Yeah.
this is a
Good
DEMIS
stuff.
DCF collaborative.
Good stuff. And we'll include a link to the flyer in the memo as well. And it's
Yep.
another example of those, collaborative efforts that DCF has entered into with our sister state agencies. And speaking of Demas, oh, oh goodness, we had an announcement this week from Governor Lamont about your colleague,
Oh my
Commissioner
gosh.
Delphin Rittman.
Yes, my sister in state government. She is, I can't tell you how beaming with pride and happy I am for her. So, Commissioner Delphin Rittman is the commissioner of the Department of Mental Health and Addiction Services. And she was a carryover from the Malloy administration. And so, right from day one, she knew, because, DCF has the child mental health component, that she and I would be doing a lot of work together. And so when I was still kind of very deer in the headlights in those first couple of months, who am I kidding? I'm still deer in the headlights sometimes. But those first couple of months, she honestly kind of helped guide me and help me, understand and navigate this role of commissioner in this role in this agency. So she has been tapped by the Biden administration to be the
Mhm.
assistant secretary for SAMHSA. So, like, dudes, leading SAMHSA, which is the Administration for Substance Abuse and Mental Health for the country. She would directly report to the Health and Human Services Secretary and President Biden's cabinet. And we could not be more happy for her. So that nomination has been put in. The White House has made its declaration of that. And so now she has to go through the confirmation process.
Confirmation
So
process. Yeah.
totally don't want to jinx it, but we can be extremely proud and happy for her nomination.
Yeah.
She hopefully could be joining Secretary Cardona. Connecticut is representing on the national level,
Hmm.
and really lifting up our best practice of collaboration. So congratulations to Commissioner Delphin Rittman for this nomination. SAMHSA would be so totally honored to have you lead that on the
Yes.
federal level.
Yes. So big congrats to her. And Commissioner, before we go into our statistical aspect of the video, you took part in a press conference with Governor Lamont and
Mhm.
Lieutenant Governor Beisowitz on Friday regarding ARPA funding
Yeah,
coming to the
that's a
state. Can you?
Yep, it's another opportunity to talk about collaboration between state agencies. So it was the Office of the Governor, along with OPM, and which is the people who kind of control the purse strings of what happens, and how the state recommends spending its budget. And then also Department of Administrative Services, and so like the governor's tight circle plus the commissioners of Health and Human Services specifically talked about some of the recovery funding coming into the state. We were also joined by David Lehman, who leads the Department of Economic and Community Recovery. I
Mhm.
know I messed up the acronym there, but he kind of talks about the business aspect of things and how we're going to get the businesses of
Back on
Connecticut up
track.
and
Yeah.
running. But the focus was really a lot on the human services like education and early childhood and Department of Public Health and DCF and DMIS, talking about how some of the federal funding coming into the state will really help lift up Connecticut's kids, families, and communities from this pandemic. And what you'll hear over the next several months is the recommendations made by the governor of what he believes some of this federal funding
Should
should
be
be
placed for.
targeted.
Yeah.
And then the legislature has a chance to look at it themselves and they make recommendations. Then the two come together, and I think within the next couple of months we should hear exactly what the blueprint is going to be for
Hmm.
the rescue spending. Lots of money coming in, lots of
Yeah.
acronyms that you'll
Billions.
hear, billions of dollars. But what that means is that families will get help. And the
Right.
message that we want to send is that, we've been here for kids and families throughout the
Yeah.
pandemic and we'll be here through the recovery. So stay tuned for some of that information out there too as we head into the statistics from the last year and what that
Great.
looks like from the last week.
Great. So for those staff who do not wish to hear the statistics, you can go ahead and turn off your video at this time. So the latest we have 361 caregivers, 296 youth, and 388 staff over the past 14 months who have been at one point tested positive for COVID-19. Big, big numbers.
Yeah, last week
Big
we talked
numbers.
about the last time we were together, we talked about going over the 1,000 mark, and those
Yeah.
numbers that you just talked about show that this virus is still kind of creeping. And
Yeah.
we want to make sure that as we continue to contact trace and continue to follow the CDC guidelines and the Department of Public Health guidance, that we do our part to still keep our transmission rate really low. So yeah, even as we talk about increasing our in-person contacts, we remind everyone that there's expectations of PPE. And specific to what you're doing and what type of contact you're having. And if the person you're having contact with has it too, we want to make sure that we know that all of our locations are adequately supplied. So
Yeah.
if you don't have any, you need to get some to make sure that you have the surgical masks and the face shields. And then we also want to make sure that, as we think about what, if any, our physical presence in our workplaces will look like, that we're still maintaining distance, we're still maintaining hand hygiene, and we're still maintaining caution and vigilance as we interact with each other more and more in the coming months.
You bet. You bet. So, Commissioner, anything else before we say goodbye for this bi-weekly segment?
I think we're good. Hopefully, we clarified things for everyone, and you'll see the accompanying documents to just kind of spell it all out. But thank you again to our regulars, and tell everybody that you know that you that doesn't listen themselves. Get information firsthand here.
You bet. You bet. Have a great couple of weeks, Commissioner.
See ya.